Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent from developing and improve from suffering with brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a physician and Chief Scientific Wellness Officer at Kemper Cognitive Wellness, and I'll be your guide on these sound waves. So whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have a loved one with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's, dementia, and just generally things in life's second half. If you have questions or comments, check us out on social media. To support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show if you find these episodes valuable. That's Patreon, Patreon, patreon.com/evolvingpast. So here we go. Let's get better. Welcome back. For the second part of my interview with Anita Saltmarche, we pick up our discussion right after discussing two cases where folks with big-time cognitive improvement had measurable gains using the photobiomodulation device. We jump in talking about who photobiomodulation or light-based therapy shown into the brain actually makes a difference for. So antidepressants were all the rage decades ago, and they were going to solve the problem of depression and many mood disorders. And it turns out I think a lot of people are kind of underwhelmed by the impact. But I mean, there's certainly people that have their lives are forever improved because of antidepressant medication. But maybe it works for about, I think the number is about 40% of people it improves, 30% of the people it makes no difference, 40% of people it makes no difference, another 40% of people get worse. Mm-hmm. You got to try it, right?
Absolutely.
Maybe we're getting a little bit better with genetics. We can predict some stuff, although my experience with the pharmacogenetic stuff is that it's not so predictive necessarily. Speak to the kinds of people or the percentages of people that you, even if it's just based on observation and it's not based on a 350-person clinical trial, which I know is in the works now, but what percentage of people are likely to respond positively?
So if we're looking at Alzheimer's first, in my clinical experience, I would say that about 75% of individuals will see improvement in various areas, from sleep to memory to behavior, if they're more severe, moderate to severe. So less aggression, less wandering, fewer episodes of becoming outraged, more cooperative. So we see sometimes different improvement. It's not always just memory, for sure.
Yeah.
And I would say about 75% of those will definitely see important life impacting changes. And for some, I think it's a combination of things. I've been working with a few individuals, and now we're just talking about dementia or Alzheimer's. We can feed the brain and provide that additional energy, but I'm becoming more convinced that for those who are able, that doing either brain exercises or other activities that will exercise the brain is extremely important. And as in your practice with functional medicine, diet has a huge impact.
Yeah.
Whether they're exercising and moving around, there are many different things. And I think light therapy is a wonderful adjunct to those. But I'm now believing that we could probably increase those clinical outcomes or the benefit of light therapy or photobiomodulation if we also add mental activity as well and trying to push individuals. So if I think about a couple of individuals I've worked with, they had already been using Brain HQ, which I'm sure you're familiar with.
Yes.
And so I think that's a fantastic program. When it was still Posit Science, I did a research study in a retirement home with Posit Science and saw some very valuable outcomes with that. So a couple of these individuals had already for a number of months, been using the Brain HQ. And one of the things that's particularly helpful about Brain HQ is it will modify the type of activities and always push you a little, not to make sure that you're having so many mistakes you don't want to continue with it, but always pushing you that little further ahead.
Mm-hmm.
And so these individuals who have been using the Brain HQ program, you're graded, or they tell you how you're doing. And there's an actual report that you receive from this. And they had plateaued at where they were with the Brain HQ. And they were both MCI, so mild cognitive impairment diagnosis, and fearful about progressing any further. So didn't have really significant memory issues, but would walk into a room and say, why did I come in here? What was I
Right.
supposed to, those
Yep.
sorts of things.
Oh, yeah.
So they started using the light therapy. And what I found really interesting was they had plateaued with the Brain HQ and not made any particular progress for a couple of months. We added the light therapy and they were able to improve 2 or 3 levels from where they were with the Brain HQ, and felt they were sharper in their day-to-day life. Like he could go to the grocery store without a list and still come home with the 4 things he was supposed to do. Or it was making a difference in his day-to-day life. So the combination of photobiomodulation with that brain exercise, I think, may be another piece we need to start looking at. And it's one I'm incorporating in with those individuals who are capable of doing that kind of thing and seeing a difference.
So let me ask a follow-up question for that, Anita, which is, I was talking to it's a big-time neuroscientist, an academic neuroscientist. He's been a guest on this show, and, he's doing other things. And in our clinical practice, we're doing brain mapping, the QEEGs. We are starting to use transcranial direct current stimulation and some other tools that add energy to the brain. And we're definitely prescribing photobiomodulation, VLights for some individuals. But this person, the scientist that I was speaking with, and I've taken this recommendation, thought about it, and now started recommending it as well. His thinking is that we may get better results rather than just slapping on a VLight or another device that will offer light and energy to the brain, and then sometime later in the day be doing Brain HQ or some variety of speech therapy exercises or cognitive stimulation. It would be to do the VLight with or while doing the cognitive challenges, while doing the Brain HQ. And so that's what we're recommending now, typically for those that can manage it. And I'm just curious your thoughts on that. If it makes a difference, you're not sure, what's your intuition?
I would absolutely agree with that. And I believe that, and with these 2 individuals, they've been doing it simultaneously. And that's one of the nice things about the VLight. It's so user friendly. You can be doing the photobiomodulation treatment intranasal as well as the transcranial while they're actually doing the Brain HQ. And I think doing them simultaneously does make a difference. I'll give you an example, and this has just happened recently. I'm working with a young fellow who's had a traumatic brain injury. He's 26, and he had a severe traumatic brain injury. After the accident. He was ventilated and comatose. They didn't think, the doctors told the family, he's never going to get out of a hospital or out of a nursing home. You should just leave it at this. His mother was so bound and determined that that wasn't going to happen. The long and the short of it is he's up walking, talking. He's written a book. He's about to start a program, a film program. He's really quite amazing. But back to this doing the light therapy simultaneously. So recently I was working, and because of COVID-19, I can't see him, but his trainer was at home with him. And I had suggested that they use the VLight along with his fine motor activities, because that's one of the things in his left hand that he's really working on. And he's got foot drop, just a little bit of it in his left foot. So they were using the transcranial as well as the intranasal photobiomodulation while they were doing his gait training and while he was catching a ball indoors. And in just 2 treatments and exercise days together, they had seen change that they haven't seen over months with him. So I think the idea of actually providing that energy to the brain simultaneously as doing an activity that you're specifically working on does make a difference. And if we look at other forms of energy, the PONS device,
Sure.
which I think is also finding or showing incredible benefit as well, and that's electrical stimulation on the tongue. And they're doing physical therapy activities, whether it's walking on a gait training or fine motor movement, and they're doing those simultaneously. So I would absolutely agree with you that I think depending on what activity or what function we're really working on. So I have a number of kids that I'm working with, children and their families, and these individuals have Down syndrome. Well, we're obviously not going to change the genetics, but we appear to be able to have a positive impact on their speech and language skills. And so speech pathologist is being done simultaneously as the photobiomodulation. And we're definitely seeing accelerated improvement and focus. For many of these individuals, is trying to keep them focused long enough for them to process and actually retain it. So are we enhancing that whole neuroplasticity process with the use of light? And I think it's really energy medicine. It could be light, it could be electrical, it could be sound. Combined with other activities, I think does make a difference. So that's great that you're doing that.
What about like ADHD? Does it make any sense that, you mentioned some, really some extreme cases like what you were talking about before, but if things like autism is also sort of a complex extreme case, things that are milder might be something like attention deficit hyperactivity disorder, has anybody observed anything in those kinds of conditions?
Yes.
By the way, ADHD is, of course, a precursor condition to Alzheimer's, or increases the risk of getting Alzheimer's.
Well, like, I guess, traumatic brain injury and concussion. So
Yes.
that is interesting. So with the Down syndrome group, when Dr. Nazer, Margaret Nazer out of Boston, and I were at one of their conferences, and at both ends of the spectrum for Down syndrome, we believe photobiomodulation may be helpful. In that younger population, in speech and language acquisition and focus and attention. But because individuals with Down syndrome also develop Alzheimer's disease very early on, we believe it may be protective. And so we're starting to recommend it throughout adulthood in Down syndrome, and may well have an impact. And part of that is based on Dr. Paolo Cassano out of Boston has been doing some amazing research looking at anxiety and depression.
Yeah, I'd recently learned about his work. Yeah,
it's really terrific. And because we were talking about pharmacology maybe not offering this population with anxiety and depression the best outcomes, that he's really looked at using in a very specific way, treating 3 and 4 locations on the skull for depression and anxiety. And
so those are areas on the skull right up front and just above the hairline, basically, the widow's peak line, basically.
Right, exactly. And so Dr. Fred Schiffer was probably the first researcher to demonstrate that with those with depression, and some of those individuals also had anxiety or PTSD, with one treatment, he was able to demonstrate significant outcomes. So Dr. Cassano has been doing research and demonstrating similarly with that population very positive outcomes for depression and anxiety. So yes, there is work in that area. And I think that's particularly important. And I think that first individual, the Italian gentleman I spoke about, I think he had a depression superimposed on his Alzheimer's
Oh, yeah. He just
from the
lost his
death
wife.
of his wife. Yes. And although he wasn't talking about it, I think that the light therapy had an effect on that, which in turn also had an effect on other symptoms more related to his Alzheimer's. So I think those two are very important and need to be looked at. And hopefully light therapy can offer a safe treatment for both of those.
Yeah, that's super interesting. I'm interested to follow the story. I think Dr. Chow at UCSF had recently published a paper on brain networks, and maybe a little bit beyond the scope of our discussion here, but it's something we're sort of following from afar, the idea of brain network activity and how to intervene in brain networks. But you did mention something that relates to brain networks, which is placement of electrodes or of the
Yes.
of the LEDs. So you mentioned putting them on F4, so towards the front of the head. The VLight, though, has one piece that goes towards the front of the head, and then three that go sort of on the back of the head over the so-called default mode network. Can you speak about why this might be important, where the lights are placed?
Yes, and I think that is very significant. It's really partly been through Dr. Margaret Nazar's work, both with stroke and concussion, that she became more and more convinced that the default mode network was extremely important in many neurologic conditions, whether they were psychiatric. And it turns out that the default mode network is impacted in dementia and Alzheimer's, Parkinson's, autism spectrum, depression and anxiety. So it is an area that we've really focused our attention on. And the VLight, being one of the devices that's out there, has really focused on the default mode network, which is a kind of large scale brain network involved in kind of the brain state of wakeful rest. And this network includes your mesial prefrontal cortex, the posterior cingulate cortex, as well as the hippocampus and precuneus, and the inferior parietal lobes and temporal lobe.
So there's some of these areas in the front, and then some of these areas are sort of just behind the midline. If you take a draw of a line over your head from ear to ear and sort of connect that
Yes,
just behind that, then and sort of deep down.
right. Absolutely. And then the intranasal is really focused, the 810 wavelength, at probably not delivering energy directly to the hippocampus, but to the olfactory bulb, which in turn will stimulate or has an effect on the hippocampus.
Okay.
And so it's not uncommon for many of our individuals who are doing intranasal treatment along with the transcranial that they start to talk about recovery of smell and taste of food, which sort of helps to support that whole idea that the olfactory bulb is probably being stimulated. So those specific areas, because they have been disrupted or dysregulated in the default mode network, there's definitely a correlation in Alzheimer's disease. And so that anatomical disruption can be from the amyloid plaques, as well as a decrease in glucose metabolism or alterations, and then just death of neurotissue in that area. So because there was this belief that the default mode network was playing such an important role, we started looking at targeting that area, and it has proven to be significant as far as clinical outcomes. And you mentioned Dr. Linda Chow, and she's at the University of California in San Francisco, and she was looking at not only the cognitive functioning, and she used not only a mini mental state exam, but the cognitive Alzheimer's disease assessment scale, cognitive portion subscale, as well as doing sort of neuropsych testing. And she had the benefit of the 3 Tesla resting state functional and arterial spin labeling and perfusion MRI. So she was actually able to demonstrate in the population that those individuals who were treated, that there was an increased communication in the hubs in the default mode network. So there was better communication prior to treatment, and that there was better perfusion, blood flow in the brain. And she was also looking at neuromarkers for inflammatory markers as well, and able to demonstrate a decrease in that as well. So yes, it was very exciting to see that they could measure fluid, and not only blood, but cerebral spinal fluid biomarkers,
Yeah.
and neuroinflammatory biomarkers, and see a difference. So yes, preliminary, but very exciting to see that.
Yeah, that really begins to speak to an understanding of, who exactly are we dealing with? What does their sort of neurochemistry look like under the hood? And then what's going on within the network? So that was a really rich and interesting study that was published last year, right? That was published 2019.
Yes.
Journal of Photobiomodulation and Photomedicine, I think, for people that are looking. CHAO is the Linda Chow is the.
Yeah, Chow. Yeah. Terrific. And she is involved in the research that's being done right now by VLight for FDA clearance.
Yeah.
So yeah, large scale. Yeah, very exciting. So she's one of the centers, as well as others in Toronto and elsewhere.
So when we're talking about like VLight, for instance, and it's not just VLight, but since we've worked quite a bit with VLight, and you're right up there with them. One of the things that can be confusing to people is there are different frequencies of devices that they sell, right? We've talked about wavelengths and nanometers and visible red light, near infrared, there's far infrared. We've talked about powers and wattage of these lights versus the lasers and coherence considerations. One thing we haven't talked about, but that's still important, is the frequencies. VLight, to my knowledge, sells a 10 hertz frequency unit, the neuro alpha, and then they're also talking about their neuro gammas, the 40 hertz frequency. Can you speak about what a hertz frequency is, and then why that make a difference in terms of the speed or the frequency that people are using to treat particularly Alzheimer's or Alzheimer's type conditions?
Yes, and that's a great question. And there are many different devices out there, and with different parameters. And your pulse frequency, or hertz, is the number of pulses per second. So you can have continuous light where there's no pulsing whatsoever. And I've had good success with that, because prior to using VLight, for years, we've been using other devices, most often in our concussion and traumatic brain injury population, at a continuous setting. But in particular, with the VLight, they started out with 10 hertz, and that's their alpha unit. And that was based on some of Mike Hamlin's mouse model work, looking at concussion and the positive impact that light therapy could have at 10 hertz. And so when we did our feasibility study, we were actually using that device. That was the only device they had available. And then after that, there was some research that came out of MIT, really looking at 40 hertz as being particularly important, specific brain pulse frequency. And so what they were able to demonstrate with the mouse model was that essentially they put the mouse in a box, and they had a flashing light at 40 hertz, so 40 pulses per second. And these mice were exposed to this. So it was predominantly wasn't put on their head. It was really through the eyes and the visual cortex of the mice that was being stimulated. And what they found is that with that 40 hertz pulse rate, they were actually, and they hypothesized that it's the microglia that were actually put in a non-inflammatory state, and they engulf or almost gobble up the unwanted beta amyloid. And with that, they were actually able to demonstrate, when they sacrificed the mice, a significant decrease of 40 and 60% of tau protein and beta amyloid.
Yeah.
And so very significant decrease in the brain. So we now believe that the actual pulsing of the light may well have a very significant impact on clinical outcomes for specific conditions and for Alzheimer's.
So that's the 40 hertz frequency, but whereas a 10 hertz frequency may be more applicable for something like anxiousness or anxiety.
Yes. Well, some of the research that has been done at VLight and elsewhere, you've had Dr. Marvin Bergman on your
Yeah.
program about a year and a half ago, and he's very much involved with QEEG and neurofeedback and PPM as well. Again, that combination of light with other modalities or other approaches. And certainly in his work, he was also able to demonstrate with his helmet, and he's using a different, not only pulse frequency, he's using a different wavelength, much higher, I think in the 1065 nanometer or something.
Right. I think it is up there.
Wavelength.
I know it's above 1,000.
Yeah, and he's been able to demonstrate clinical outcomes, significant clinical outcomes as well. But VLight did some work looking at the gamma and the alpha. And it appears in this first research that they looked at in healthy individuals that the alpha, as you mentioned, was fairly calming and had an effect on the alpha brain waves, which would calm and decrease anxiety and those sorts of things. And it happens to be the wavelength that we use right now for concussion and TBI. The gamma pulsed frequency, on the other hand, is not only impactful for gamma, but also has an impact on the alpha as well as the beta wavelengths. And so I think we'll find over time that frequency or the pulsing of the light may well have a significant impact on outcomes.
Excellent.
Lots more to learn, but yeah, it's very exciting.
Totally. It's a very exciting time to be in the space. Are there any side effects to these devices? What do people have to be concerned about? Adverse effects, etc.?
I have individuals that I've worked with who've purchased home units, not for traumatic brain injury, but for musculoskeletal conditions. So arthritis of hands, knees, elsewhere, pain. And they've used those devices daily to twice a day to get up in the morning and get started in pain so they can sleep better. And they've used these devices for years with no ill effect whatsoever. One of the two individuals that Dr. Nazer published, we published a paper on the two first case studies. The first individual, this woman I was telling you about, who was the first one who slept for 13 hours and family were concerned until she woke up and it was positive.
Yeah.
Again, this learning with staying in touch with patients and things, she had a terrible flu and wasn't able to do her photobiomodulation treatment. And she wasn't using the VLight. It wasn't around at that point. She was using another device. And so for about 3 weeks, she wasn't treating. And she went back to treatment. And during that 3-week period, she found she was starting to lose some of the gains that she had with using the photobiomodulation. And so she restarted. And what was interesting to us is that she had plateaued with the use of the light therapy and taking this light holiday. Wasn't prescribed, but she did take it. We now do prescribe it at times. And she had this light holiday where she wasn't treating, and she went back and she not only regained where she was at that plateau, but went beyond. And so in that instance, that long-term use was not detrimental at all, but actually seemed to be positive. So we have a number of individuals who have had ongoing treatment. Many with concussion or traumatic brain injury won't have to treat consistently 3 times a week as they do when they first start, but they almost treat on a PRN or as needed basis. So if they're under a particular amount of stress with work, emotionally, whatever, or they've been sick with a bad flu, they'll use the transcranial PBM, and actually it enhances their cognitive functioning. And so they may not use it consistently, but they do continue to use it. So I think the only paper I've really seen is Paolo's, Dr. Cassano's paper, looking at long-term use. And they were using much larger doses, like much larger number of joules per centimeter squared, treating 2 locations. And they did have very minor side effects. I think the first few treatments, there may have been a slight dizziness. And we know from overstimulating the brain, we can exacerbate symptoms. So for someone with a concussion, their headaches can become more severe, their memory issues, all the post-concussion symptoms can be exaggerated. That appears to be transient. If they stop treatment, it will revert and at least go back to where they were previously, which I think really addresses, we talk about that biphasic dose where we increase the delivery of energy to a point where we get the maximum benefit. But if we go beyond that, we actually see that curve going down if we're looking at a bell curve where we're actually seeing inhibitory effects rather than stimulatory effects. So we've been particularly, I believe, conservative in the way we've approached treating the brain. And we use LEDs. I have sort of criteria that I usually screen for to determine whether I will start slowly and gradually build up their dose, as opposed to giving them the full dose, even with the VLight, and then work with them and make modifications on frequency of treatment and other locations if we need to add them. So I have not really seen any negative consequences with long-term use. There appear to be certain conditions like CTE, some individuals, with neurodegenerative conditions. Once you start this treatment and you see the benefits of photobiomodulation, most often in a degenerative condition, you're going to need to continue to use the modality, or you will lose the gains that you have achieved with the additional energy to the brain.
I want to ask you a question, but I want to speak to my observation of side effects because they're a little bit different. And then I want to ask you about dose considerations and light holidays. But the things that we've observed, and it's mostly in younger populations that without neurodegenerative diseases, even with the alpha device, I'm talking about VLight. Kemper Cognitive Wellness had purchased a couple of devices where we both have the alpha and the gamma. So again, the gamma is primarily being recommended for the neurodegenerative conditions, Alzheimer's, and the alpha units are being used for other things, although you mentioned in your study that you did use the alpha unit for people with cognitive impairment. So just to be clear, so everybody tracks with the conversation, because the lingo is a little confusing. Anyways, with these things, sometimes just the nose piece bothers people.
Mm.
That's one thing, but it's a little uncomfortable, but that usually people get used to. When my wife put it on, I had no problem with it. I don't have any problems tolerating it. No issue. You almost don't notice it's there. You don't feel it doing anything while it's doing its thing. When my wife first put it on, within about a minute and a half, she developed a pretty significant headache where the top light was. And so I called the device manufacturer. I also called Dr. Marvin Bergman as well. And I said, what's going on with this? I didn't see this listed. And so they both described to me what they thought maybe was a mechanism of why this was happening. But essentially what they said was, maybe you're opening up a new blood vessel, something's getting cleared out, etc. It was a fairly intense headache that went away within seconds of removing the device. Like it was less than a minute or two. It was about this time last year. Then what we did was we kind of stepped up the dose. So she was able to tolerate it sequentially. Like there was a little bit more and a little bit more until she was able to tolerate the full kind of treatment, the 20 so minutes that the device is on. But it just took a couple of treatments to kind of get used to it. So I had seen that. I've seen a lot of people use it. Most people don't seem to have any adverse effects at all. But that was something that was very clearly noticed. And I saw that one other person as well. So just FYI. but this was on very intermittent use. This wasn't on consistent use. But transitioning to the dose piece for people with, cognitive impairments. Now people have real, they're having problems. We're not using like this for a vitamin, for preventive reasons. We're using this because they're sick. They have brain damage. Do you have a sense, especially with like a VLight, the neurogamma, 40 hertz plus the intranasal device, do you have a sense of how often people should be using it? Typically every day, a few days a week. We're seeing people with effects that are using it every day. What's your sense?
I think that sensitivity is to light. Everybody's different. There are often, certainly in our concussion, traumatic brain injury group, there are a few triggers for me that say, we have to be very careful here. And so incredible hypersensitivity to either auditory or visual stimuli, so light or sound, sensitivity to medications, and also headaches can be indicators that these individuals, at least in a group of concussion patients, can mean we have to start out slowly and not start with a full treatment. Because the vast majority of my caseload actually is in the US and Europe and Asia, and I don't see them personally other than on a Zoom call, I tend to be very conservative. So I never have them start with a 20-minute treatment. And if their sensitivities are high, then I will even maybe just start them out with just an intranasal treatment, and then we'll go to a transcranial and start them at 5, 10, 15, and work up each session to 20 minutes. So that they're not going to experience that, because my experience has been, if you're working with a family remotely and they encounter a problem like this, it's very difficult to convince them it will be okay next time if we start much lower.
Yep.
So rather than just bypass that, we start and increase that. I will normally start with the gamma 3 times a week, Monday, Wednesday, Friday, with some time in between treatments, and increase the amount of time per treatment. If I'm not seeing results after 3 times a week, then I'll go up to 6 times a week with 1 day off. And quite often, I do believe that the addition of the 633 visible red intranasal, along with the gamma or the alpha for that matter, is particularly helpful. And so they will often purchase both those devices. The gamma, which is the head frame, and the 810 or infrared intranasal, as well as the 633. They have 2 visible red intranasal devices. The 633 is an LED, and the 655 is a laser. I've just had a couple of occurrences where individuals have become agitated and antsy, is the way that they describe it, with the 655. So I tend to recommend the LED, which is the 633, and I've never had that kind of side effect or noticed experience.
So let me ask a clarification question with that, because that's an interesting point. I know there's some disagreement, and I have limited knowledge. I'm sort of a newcomer to this, but my understanding is that there's some disagreement about some of the lower wattage devices, be they LED or lasers. But you were speaking to some extent before about coherence and the different considerations about tissue penetration. I'm reviewing a paper for someone who's submitting this for publication, where they're using one of these higher powered, a Thor laser, and they're using imaging to target where in the brain they should guide it. Is it possible that the laser has deeper tissue penetration, and if you're really targeting where it needs to be, you really don't know what the side effects are because the lasers have better tissue penetration? Is that a possibility, or are we not thinking about that? Am I missing information even to be asking these questions?
No, not at all. I think that's an excellent question, because we're so early on in the field. I mean, there are definitely those who use, now, James Carroll's Thor equipment, which is great equipment too, is much more high powered than the VLight, and also uses a combination of visible red. If he's using the cluster, I'm not sure what device. I don't know if they were using the laser probe, single diode laser?
Yeah.
Yeah. Okay. So yes, I think in the best of all worlds, if we had some way of guiding where we should be treating, that would be terrific. And that's why the thought that if the default mode network is the culprit in many of these conditions like Alzheimer's, then we are guided by the hubs that are included in the default mode network as those are areas we should go to. I'm also aware of research that's going on in Australia, and they're looking at QEEG as a way of determining the amount of energy and the location of treatment, which is a bit different for boys and girls for autism spectrum disorder. So I think if we have guidance, that is terrific. Now, the question of laser versus LEDs in the population, both for Linda Chow's work out of California and Dr. Nazar's work out of Boston, and the functional MRIs, these specific areas that were treated, these hubs, the default mode network hubs, showed greater perfusion and cellular activity specifically under the areas that were treated. Now, those hubs are not pinpoint areas, they're larger than that. So would it have been better had those same areas been treated with laser versus LEDs? That's a very good question. And I think in time, hopefully we'll have a better idea. But we know with the LEDs that were used, and I've used the Medix health devices, which are a cluster versus a small single diode in the VLight. And those were the devices that Dr. Nazar was originally using before she had a helmet produced. And so under the specific areas being treated is where we saw the increased activity. And so I don't know that we're doing full brain stimulation, although if we were treating subexhibitally at the back of the skull, and in some treatment protocols that I've seen, they use a very large array and they treat back there and then they just treat the entire skull. Mm-hmm. And maybe we'll see effect, but I think we do have to be more specific about where we're treating, because I think we run the risk of overstimulating the brain when we just sort of willy-nilly treat the entire head with no specific locations that we're trying to target.
I agree. I have the same concern. You've mentioned Medix, you've mentioned Thor. Other than VLight, are there any other, in your opinion, reliable photobiomodulation, transcranial photobiomodulation kind of devices that are over the counter available for consumers?
So over the counter, so that does make a difference. There are a number of studies going on right now using high-powered lasers in clinical arenas, and they're seeing effect as well. So I certainly wouldn't say that just the low-powered devices, but my concern is, having worked in and taught in so many different clinics, after a while when people become more comfortable with technology, they tend to give that technology to less educated individuals in the clinic who are assistants. And so clearly you wouldn't want to be able to do that with a high-powered laser.
Right.
So I think low-level energy is probably better. I think there are a number of other devices out there. I mean, if I think of some of the work being done out of Australia and looking at Parkinson's, and they've had some very positive effects treating transcranially, really the whole head. And John Mustafas is one of the researchers there, and he's absolutely amazing. And he truly believes we need to get this technology at a fair price into the hands of individuals who can use it. So he's actually developed his bucket routine, where he literally has a bucket and they line it with LEDs and they put it on their head and they've seen some positive effects. Yeah, I guess we're going to see that. Is it safe, and how frequently are people doing it?
Who knows?
Yeah, who knows? Even with the VLight, and it is available to individuals, I think you're going to see better clinical outcomes if you are under the care of someone who can help you with that process. I think home treatment is absolutely the way to go. It's almost impossible to have individuals come to a patient clinic 3 times a week. That is very difficult to handle. So I think being monitored, and I was talking to a researcher the other day, and he was saying, yeah, I have my patients, because he's doing a research study, I have my patients take a photograph of themselves doing treatment, which is dated and stamped. So that's his way of trying to verify to FDA that it's actually being done 3 times a week. So I think there are positives, and it gives control to the individual. I mean, I was on your website, and clearly you partner with the patient for them to be actively involved in their treatment. And I think this is one of those treatments that they can be actively involved in under your supervision.
Yeah, that's the whole idea at Kemper Cognitive Wellness is, it's not about coming to the doctor for the answer. It's about
Yes,
getting them on the path so that they can do the work that will ultimately benefit them. And when we enter into those kinds of partnerships, that's where we see the most exciting results. People that are just expecting to come to the doctor. What are the 3 things that I need to take to get better from Alzheimer's? We have to have a different kind of talk. But
absolutely.
a couple other questions, just wrapping up here. Some people think that giving so-called mitochondrial support products like CoQ10, there's a number of them, but to go into all of them. But have you tried this? What do you think that's about? Especially given some of the mechanisms, the proposed mechanisms, what we know or what we think we know about the mechanisms of photobiomodulation. Do you think there's anything substantial there about pairing the actual LED, the low-level LEDs, with mitochondrial supports?
I think that's a great idea. I think that's another area we need to look at. I have read one paper where they were looking at depression and the use of photobiomodulation with or without CoQ10. And they had better outcomes with the pairing of CoQ10 and photobiomodulation. So that does make a lot of sense to pair those 2 together.
Interesting. And then I think just the wrap up question for me is, it was particularly speaking about the neurodegenerative space and Alzheimer's, maybe concussions, but Parkinson's. Where does this field going? Like, what's the next 3 years look like? What are the things you're most excited about?
I think it's an incredibly exciting time when it comes to photobiomodulation transcranially. There are some implantable devices that are being proposed. I tend to want to be as non-invasive as possible from a safety perspective. And I think home treatment is really where we're probably going to move. But as you spoke about earlier, one of the areas that I think will be very exciting is whether we're using brain mapping or scanning to see where and how we should have an effect on the brain. I think the more accurate we can deliver that energy, the better clinical outcomes we will have. And if we can pair that with home treatment, I think that will make a big difference. And when it comes to Alzheimer's, I think the other thing that I found helpful in this, and this is why doing it on your own is different than really working with someone to monitor and supervise this. So many of them feel there are no potential treatments and they've lost hope. And I think the ability to work with them and show them that there's certainly hope as well as treatment, whether we call that a placebo effect or not, if we can change cells, DNA with thought, then I think having them understand why and how this potentially could help them will only enhance outcomes. And so I think that home treatment being supervised and helped, the monitoring of where we're treating and being used for many different neurologic conditions, And we haven't talked about it, but there's a lot of research going on right now for healthy individuals and
Yeah.
enhancing cognitive functioning. And I think that's another area we will see a lot of work being done.
Absolutely. And we started to make some recommendations in that regard to, people that are trying to prevent or optimize or prevent cognitive aging. It's really such an interesting time to be in this.
It really is.
Anita, thank you so much. We're privileged to have you. I hope to have another conversation with you in the not too distant future. Where can people reach you most easily?
They can reach me at my website, saltmarchehealth.com. And you can certainly give out a telephone number, 416-579-5773. We work with individuals literally all over the world, so we would be happy to be contacted.
Anita, thank you so much for joining us.
Thank you. Take care and be well. Stay healthy.
So that's our episode. I hope it was useful to you. Check out the show notes on iTunes or on our website where we've summarized the key points. If you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. If you have questions or comments, connect with us on social media. Finally, to support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show. That's Patreon, Patreon, patreon.com/evolvingpast. Thanks, and talk to you next time.